So I'm here now with Kuo-chi of Taiwan, who's a retinal specialist there. And actually, I've just managed to bump into the gold standard of interviewees because Kuo-chi actually has some practice being on a talk show before in Taiwan. So that was a great experience, I hear.
Yeah, it's just like entertaining talk shows in Taiwan, and it's a show, and they recruited old doctors to their TV shows and to share their experience in hospital and how the work have done and how we deal with the patients and some interesting stories about maybe dating with nurse or something like that. But it's not a professional show, it's just an entertaining show in Taiwan, yes.
Well, here at Pi Magazine, we like to keep things light, professional. It's an age where we can just mix it up, right?
Yes, of course. Maybe here, just like, because you told me like I look in a really fashion suit, like me, and you also look even more fashion like me. So I think we can make the professional just like have some entertaining perspectives.
I gotta say high five to that.
High five.
Yeah, sweet. All right, so Kuo-chi, you're a young guy, but I'm sure you're fully immersed with what are some of the gold standard treatments, diagnostics, etc. about our field. Is there anything that you try to rely on as an ophthalmologist?
As an ophthalmologist, we all know we have to be equipped because we need to rely on so many just like machines and so many investigation and tools to help us diagnose disease. Then we can move further to the treatment part and in order to save some visions of my patients. So as an ophthalmologist, we need to rely on just like the modern OCT, Spectral Domain OCT, and some injection of fluorescing angiography to show the condition of their retina and their fundus, just like posterior segment of our eyes.
Right.
And just like color fundus photo, it's the initial tool to help us to make impression of what kind of disease these patients might have.
So you mentioned Spectral Domain OCT.
Yes.
Swept source OCT is out there on the horizon as well. But I guess would you consider SD-OCT still the gold standard?
It's kind of maybe a little bit easier to that because we know there are VR now. The AI it becomes more popular and popular. So maybe in future we do not need to rely only on SD-OCT. We have further tools and further vision, further cameras to help us to diagnose.
Great. And then on the treatment side,
yes,
I guess anti-VEGFs would be the mainstay of most therapies in the posterior segment for AMD and such.
Yes.
Would you rely on laser at certain points, like for DME as your first-line therapy?
Yes, actually, I know because I'm young. When I was a resident, the anti-VEGF injections are really popular for ophthalmologists. So right now, as I am a visiting staff, so as for my patients, I would prefer use anti-VEGF injection rather than laser. I will keep laser for those disease or condition which are not has good response to anti-VEGF.
Okay, so it could be a second-line therapy.
Yeah, second-line therapy for me, for sure.
Does it work? I mean, I guess that's still an effective niche, right?
Yes.
I mean, because anti-VEGF won't work for everyone, so it's good to have a backup plan. Yes,
it's just a backup plan. But actually, right now we have so many different kinds of anti-VEGF, just like the Avastin, the bevacizumab, the ranibizumab, and right now the Eylea. So we can switch. Just like some doctor talking about their strategy, their treatment experience, one patient might not have good response to one anti-VEGF. When they switch to another anti-VEGF, the fluid disappears. It's just like a miracle.
Wow.
So maybe we can switch first, then move to the laser as the backup, maybe the last line. Yes, because you know, laser always has some trauma on macula, and that's the worst things we wanna see, because it might cause scar formation and something like that, and may influence their vision. Yes.
It's funny how in different fields of the eye, I mean, if you talk about the anterior segment, you know, laser incisions instead of the microkeratome have become kind of a gold standard. It's considered very innovative.
Yes.
You know, but in the posterior segment, it's still drugs that oftentimes reign.
Yeah.
You know, so perhaps there's a future out there for laser. We've heard that maybe for DME, it's especially could be useful.
Yeah.
But yeah, I guess the future is bright. Would you consider, though, that there could be more laser opportunities eventually in ophthalmology, in the posterior segment side?
Of course, there's still some application of laser, but just like to heal the retinal breaks and to avoid the retinal detachment, which was a really devastating disease for eye.
Yeah.
So it's just like laser still, or we cannot, it's not this possible. We still have to need laser to help us. Yes.
That's great. That's great. Now, finally, you know, as a young ophthalmologist, what do you think your own perspectives are? If you had to review your own perspectives about, you know, gold standard treatments, do you think that they differ from older ophthalmologists? Because you're younger, are you willing to try something new, or it really doesn't matter? It's all goes back to the robustness of data behind these procedures.
It's indeed. It's not just for doctors. I think for everyone, younger people would like to try new things. Would like to try and would like to just compare to old people, because people used to their own experience. Sometimes we rely on our old experience, but I know the situation is maybe kind of different in Taiwan. Just like in Taiwan is small and hospitals are everywhere. So usually we can discuss with our teachers, and we maybe have a group agreement on how we treat these patients. I think our teachers still would like to try new things and new tools and maybe new drugs, including just like AI, some new involving just VR systems to help us to maybe deal with our patients' vision better. Yes.
Excellent, excellent. Well, hey, I'm so glad we got to hang out a little bit today.
Me too, it's my pleasure.
Yeah.
I just finished my speech.
Yeah,
and I just come out and you told me, oh, can I have a video? Well, it's my pleasure. Yes, thank you.
Yeah, I'm glad I got your attention with my gold suit, you know?
Yeah, it's obvious. It's attract everyone's eyes. Yes, catch everyone's eyes. Yeah.
Awesome. Well, next time I'll bring you a gold hat, and then you know, we'll do some rapping about the posterior segment.
Maybe I should wear that gold suit and to have video with you, or maybe we have a picture together. Yeah.
Great. All right, well, we'll see you next time, and thanks for joining us.
Thank you.
All right, cheers.
Cheers.